Arkansas's most abundant natural resource provides the core asset for Deltic Timber Corporation. In addition to the sustainable yield stewardship of its well-stocked timberlands, Deltic adds value by integrating its efficient wood products manufacturing facilities, as well as through planned development of commercial and residential real estate. Deltic Timber Corporation, creating value for a growing Arkansas.
St. Vincent's health system has been a part of the Arkansas healthcare scene for more than 125 years. Its parent company, Catholic Health Initiatives, has been making major moves in the last few months to reshape that landscape. An acquisition of QualChoice Health Insurance and a merger with Hot Springs-based Mercy Hot Springs Hospital. And there's also a partnership discussion with Conway Regional Hospital. Joining me is Peter Banko. He is the CEO of St. Vincent Health. Thank you for being here. You've been busy.
Good busy.
A good busy.
Yeah.
Yes. Better than the alternative you were telling me.
Yeah, I don't like sitting on my hands.
Well, let's start first with the Hot Springs Hospital and what's going on there with Mercy Hot Springs. 282 beds, I think, down there to go with your more than 650 at St. Vincent's. Tell me what's the economics of that deal?
You know, they had a failed merger with National Park. Due to FTC and Vatican concerns, so we came in on the back end of that. We think we need to have more scale to be relevant, so getting some economies of scale, getting larger is a good thing. Having a larger footprint than just maybe Little Rock, North Little Rock, Morrilton was in our future, and so the mission and values were very closely aligned, so that's why we went after that opportunity to acquire that facility there. So yes, a large hospital, really a hub for Southwest Arkansas. Cardiology, orthopedics, neurosurgery, oncology, and then about 120 employed physicians. So really a robust, vibrant healthcare scene in Hot Springs.
So now if I'm looking at the map, you go Morrilton, Hot Springs, obviously Central Arkansas. You're missing a little butterfly wing on the eastern flank there. So maybe something could be, maybe something in the works there.
Well, you know, the growth corridors in this area are down I-30, Benton Bryant, and then Conway to Russellville, so and probably up to Searcy. So you'll probably see more activity down to Pine Bluff in those areas, maybe not going as far east.
Yeah. Let's talk about the Conway affiliation, Conway Regional Hospital. You guys are just in discussions right now. Nothing's been tremendously formalized, but kind of bring me up to speed with where that discussion is at this point in time.
Yes, we're in confidential discussions. We've developed a framework to work with one another that I can't talk about. Sure. And we're working through the letter of intent process, and hopefully that'll start speeding things up where we can start working more closely together.
Well, tell me why an affiliation versus a full-blown buyout might make more sense. Kind of what's the difference between what you did in Hot Springs and what you're doing in Conway?
I get to know each other, so it's like living together, which you're not supposed to do as a Catholic, but it's like living together before you get married. So getting to know each other, starting to work together so that you feel, rather than going all in and then figuring things didn't work, getting to know each other, work on some things, and as that gains momentum, maybe then if it makes sense to integrate more deeply. Now, for not every organization, ownership, sale, giving up things makes sense. So preserving the autonomy of the Conway Regional Board, preserving that leadership team, they've been around for decades too. So keeping what they're doing best and bringing the advantages of a large regional and national health system to bear.
Well, maybe not living with each other. How about just a long-term dating relationship there?
Yes.
Is that a little bit better?
Yeah.
Let's talk too about the Catholic Health Initiative's acquisition of QualChoice. I know you weren't necessarily involved in that, and you're not in that leadership organization other than just the parent company tie there, but it speaks to a little bit larger picture of healthcare reform and what we are seeing happen, not just in the Arkansas market, but nationally. Tell me how that transaction, how does that play into what's been going on in terms of federal healthcare reform for the last few years?
So you're going to see the blurring of lines between hospitals, physicians, outpatient, and payers. So that's the CHI's acquisition of QualChoice is down that end. So we have stated that we're going to start to blend those lines. We acquired a Medicare Advantage plan in the Pacific Northwest outside of Seattle as our first. QualChoice, after the departure of the U of A employees, needed a partner, and we were the logical choice to do that. So it was really allowing us nationally to get into the health plan business less expensively, build a platform for national health plans, and also provide some more competition in Arkansas.
Well, and now, and part of the information that was released as part of that deal described this as making healthcare more affordable, more accessible. That was supposed to be, is supposed to be the goal of the federal healthcare overhaul.
Yes,
Right?
yeah. Well, I think the federal healthcare overhaul has spent more time on contracting costs. So, Medicare cuts, Medicaid cuts, disproportionate share cuts to providers. So it's focused more on the cost side. I don't think we've seen the transformation enough to start to impact quality, but you will over time. There's going to be a shift from fee-for-service to fee-for-value. Mm-hmm. But I think that'll take time, and different markets are working at different speeds.
What are you seeing in terms of accessibility, though? It seems like from a lot of the data we're getting, at least in terms of the private option, and I use that as just kind of a slice of what's happening in the overall healthcare market, we do seem to be seeing more people accessing the system because they've got health insurance now.
We're definitely seeing more people access our primary care physicians and our employed network. We're seeing rapid growth in our emergency department visits as well. We're seeing individuals.
So you're seeing an increase in emergency room visits.
Yeah, rather almost hockey stick exponential growth, where we had been flat at St. Vincent for a while. We're seeing month to month huge increases.
That is a little bit of a contradiction to what some other hospital executives have said they have seen in terms of emergency room visits. They've seen a decline in that from some legislative testimony. Do you know why you're seeing the increase?
We're just doing a better job in our emergency room, and people
They're all
are coming
coming
to
there.
us. Yeah, I mean, we have spent a lot of time on efficiency and process in our ERs, and we were stagnant, but we are seeing an uptick in ER visits.
Is that a good thing for you? Do you want to see more emergency room visits?
It's not the best place for folks to get care. You should be going to a primary care physician, your pediatrician, your family practitioner, your internist, your OBGYN. So certain things belong in the ER, other things belong elsewhere. I mean, we've been seeing a proliferation of urgent care centers, at least in the Little Rock market too, and they all seem to be doing pretty well. And our West Little Rock urgent care center is doing well too. So I don't know what others are seeing. We're seeing an uptick in those urgent emergent visits.
Lots of data to kind of analyze and look at. I know you're a data freak, which I like about you so much. So what are you seeing in terms of some of the reforms going on at the state level to try to bend healthcare costs? Obviously the private option, another big kind of component of state healthcare reform. You mentioned the payment initiative that has been underway for some time. Is it working?
I think Governor Beebe's trials in bundled payment and the medical home are definitely working. We're seeing right now, we're also in a Medicare pilot for bundled payment, and we're seeing for hips and knee replacement, we're seeing large reductions in costs. We're able to, our physicians along with the hospital and hip and knee replacement have really gotten together, looked at better quality, better reducing infection rates, how to provide lower costs, not withholding care, but we know when someone goes to rehab or a skilled nursing facility, the infection rate gets higher. So our physicians try to discharge people home with home care. So it's really, I think, better coordinated care and improved care, and we're seeing reduced costs at St. Vincent because of it.
All right, Peter Banko, CEO of St. Vincent Health. Stay busy, my friend.
Okay.
All right, thank you for being here with us.
Thanks, Robbie.
All right, when we come back from this word from our sponsors, this week in Arkansas history, I'll look at the last statewide Republican runoff. It was nearly a quarter century ago. Who were the players? Find out when we come back.